Hello everybody and welcome to this news report with me, Geordie talking Tom. Today's edition is all about the NHS. But why are you so angry here? Well, this is why we're angry. Watch this.
Tony Blair once told us that his priorities could be summed up in 3 words. Education, education, education. I can do mine in 3 letters. NHS.
Liar.
We can look the British people in the eye and say this party is the party of the NHS today, tomorrow, now, always.
That would be a lie.
First, I want to tell you what we're not going to do.
This should be fun.
There will be no more of those pointless reorganisations that aim for change but instead bring chaos.
Yeah, telling fibs, Mr. Prime Minister.
Today, the Conservative Party is the party of the NHS.
Dave Monster!
And today we are starting with our number 1 priority. It was our number 1 priority 4 years ago when I became leader of the Conservative Party, and it has remained so ever since. It is only 3 letters long, but in its letters lie the hopes of millions of people in our country, the NHS. I'll cut the deficit, not the NHS. And don't for 1 minute buy the Labour claim that they will do the same. They won't, and their figures show that they won't.
Liar.
We are going to change the way the NHS works because it could be so much better.
Aye, it could be privatised, couldn't it, David?
If we win this year's election, Andrew Lansley and his team are going to give the NHS back to where it belongs, to the people.
Oh, your pants on fire, Dave.
To the doctors and the nurses and the professionals who work in it, to the patients who get their care from it, to the families who depend on it. Every policy we put forward, every reform we implement, every change that we make will have at its heart this simple idea that we need to give the NHS back to the people.
This wasn't meant to turn into something comical, Dave.
I start this year incredibly optimistic about what our country can achieve. Yes, cuts in spending will be felt.
You're telling me.
And yes, they will be difficult, but they are absolutely vital in restoring the credibility and confidence that will mean jobs and growth in the future.
I wish that it was still 2011 and we could tell everybody about the changes that you're going to make and the utter destruction to our welfare state.
I want one of the great achievements of this government to be the complete modernisation of our public services.
Ladies and gentlemen, boys and girls, I'm sorry if I keep butting in, but he means total annihilation.
I want us to make our schools and hospitals amongst the best in the world, to open them up and make them competitive, more local, more transparent, to give more choice to those who use our public services and more freedom to the professionals who deliver them.
He means he wants to privatise them. He wants to sell them off to the highest bidder. But in the case of the NHS, he means sell little bits off to his friends.
I don't want anyone to be in any doubt about how important this is to me.
Don't you worry, Dave. I've got your cards marked.
And I want to do right by them.
Liar, 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 liar.
We've got the creativity and the energy. We've got the language and the global position. We have the relationships abroad, the stability at home, to make the most of the opportunities that globalisation is bringing.
How much shite are you going to talk, Mr. Prime Minister? You fell out with Europe, you did your little veto, they didn't speak to you, Obama's not very keen on you, and there's NATO for prosperity. What on, what off?
And one of the keys to success for countries like ours will be the performance of our public services.
That'll be the public services that you're going to cut and cut and cut and cut and cut and cut and cut.
I passionately believe that it just doesn't have to be this way. We can change these things. So we're determined to modernise our public services and make them better for everyone. Now, I predict that some eyes are rolling.
Rolling? It's 4 o'clock in the morning and you've got me wide awake on edge, Mr. Cameron, pitching at what you're doing, man.
First, the money question. How do you modernise public services when there's so little money?
Well, what you did, Mr. Prime Minister, was to cut everything. You cut loads and loads and loads of public service jobs.
Now, of course, these changes have to be carefully worked through, and that's exactly what I would argue we've done. Years of preparation in opposition, and we must continue to do this every day in government. But remember this, every year we delay, every year without improving our schools, is another year of children let down.
And you wouldn't dream of letting the bairns down, would you, David? You wouldn't shut all the swimming pools, all the libraries, all the play centres, all the community centres, would you? Nah, you wouldn't think about doing that, would you, David? Not to the bairns.
8 months in, and you can see we're simply not wasting a moment in attempting to deliver first-class, world-class public services in our country.
You know what my mum would say to that, Dave? What a pile of shite.
And it's the mission of this coalition government to renew that promise of opportunity, fairness and excellence for all in our public services today and into the future.
Don't make me laugh. Now you know what they've said. Now you know what they've done. I'd just like to remind you a little bit about what the NHS is supposed to be about. And what it was like at the beginning.
This leaflet is coming through your letterbox one day soon. Or maybe you've already had your copy. Read it carefully. It tells you what the new National Health Service is and how you can use what it offers. Hospitals and specialist services, medicines, drugs and appliances, care of the teeth, care of the eyes, maternity services, home health services. The new scheme starts on July the 5th. But there's one thing you should do at once. Choose your doctor now. That's most important. Study the leaflet, then keep it by you. You'll need it for reference. The new National Health Service starts, providing hospital and specialist services, medicines, drugs and appliances, care of the teeth and eyes, maternity services. Ask your doctor now if he'll look after you under the new scheme. If he can't accept you, ask at the post office for the address of the Executive Council, where you'll be given the names of other doctors in your area who are taking part in the new service. Ask the doctor you choose for an application form for each member of your family. One form has to be filled in for each member of the family and then handed over to your doctor. Now don't forget, choose your doctor now.
Our plan is a service which will provide the best medical advice and treatment for everyone, every man, woman and child in this country. It will cover any medicines you may need, specialist advice, and of course hospital treatment, whatever the illness, special care for mothers and children, and a lot of other things besides. In fact, every kind of advice and treatment you may need. Now all the details are set out in this white paper and in a shorter pamphlet. And you'll find there the arrangement the government proposed for the doctors, the hospitals, the local authorities and so on.
Can you just imagine me being your journalistic type reporter Geordie Cat back in the 40s talking like this just so everybody could understand me?
On his walk into Downing Street, the Health Secretary Andrew Lansley is confronted by a small group of protesters angry over the government's controversial NHS reforms.
From 600 to 50 doctors. So you can wait. So you can wait. Let you wait for change. You can wait. You can wait like people are waiting for a bed now.
I promise you,
and when it
waiting
goes
times in the
private,
NHS
when
have
it
gone
goes
down.
private,
It will not
we
go
won't
private.
have any bed. No, I've had enough of you. I've had enough of you. And this is 1979. Don't you dare lie to me.
79? No.
I'm not going.
Sorry,
I'm not letting it go. No, I'm not letting it go. No.
I'll go the other
No,
way.
I've been waiting to get this man for bloody years.
Raymond!
No, you're not.
Dave, boo! Boo!
Career's over.
Traitor! 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 Shame on you!
Possibly the best piece of film I have ever seen with Mr. Andrew Lansley.
Meet with the health ministers of the Celtic nations every month. Given that all three totally reject your healthcare proposals, what do you actually talk about?
Would you concede that the NHS has not been as well cared for on your watch as you promised?
Why, when we agree with you, are we a professional body, yet when we disagree with you, just another trade union?
As a party who champions law and order, what does the Minister think of someone removing just under £100 from my wage packet last month, without my permission, to put into the NHS pension scheme, which yielded the Treasury a profit of approximately £2 billion last year? Is this theft? And should the government be prosecuted?
If the Secretary of State is so convinced regional pay is right for nurses, will he today also call for it to be introduced for MPs in constituencies outside the N?
Who would you hold responsible for the staffing cuts and the subsequent impact on patient care? The trust boards or yourself as Health Minister who has set government policy?
Did you manage to see the smug eyebrow lifting Mr. Lansley during that report? He lifted his eyebrows in contempt of the nurses asking him questions about why he and his department were cutting nursing staff from our NHS hospitals.
Trust's own figures, and they're freely available, show that 50,000 staff, including tens of thousands of frontline clinical staff, will lose their jobs in these rounds of cuts at the moment.
It was obviously an expensive decision to take at that stage. For a whole period of time it lacked sufficient investment, and particularly during the 1980s when Margaret Thatcher came into office, there were 3 years in a row where actual spending on the NHS in real terms actually fell.
The internal market originally started under John Major, and that was really when they divided healthcare up into buyers and sellers, instead of money being allocated to hospitals and then they had so much for a year and that was what they had to spend.
By the time John Major was kicked out in 1997, you had a waiting list well over the million mark, people commonly waiting over 2 years for operations. What we've seen under Labour since 2000 is substantial increases year on year in spending.
And things improved, no question about it. Waiting lists came down and patients' experience was good.
But coupled with attempts by Labour, and now of course being driven forward by the new government, to give a greater share of that money to private providers.
There's no reason for the shift from the public provision to the private provision, and every time private providers have been entered into the UK system, back in the 80s and the PFIs that were introduced in the 90s, it's been very expensive.
The PFI disaster, when I found ourselves paying 60-something billion pounds, taxpayers' money, our money, for £11 billion worth of hospitals.
We're still seeing hospitals having to cut services in order to make these payments to banks that are pocketing the profit. The first thing they have to do is to pay the PFI bill, because they're actually obliged to do it under absolutely watertight contracts. Around the world, competitive healthcare systems are more expensive, less efficient and more dangerous actually for patients, because there are greater numbers of accidents and there are greater problems in following up difficulties, because that then generally is thrown back on the public sector.
Companies are going to come in promising that they can deliver things at a cheaper price than someone else and drive down the quality of what they're actually doing. And part of that, of course, will be done on health service staff.
A Conservative Party determined to ruin our National Health Service. A Conservative Party deemed by one great, very special man to be lower than vermin. Thank you once again for watching, ladies and gentlemen, and the next Geordie Talking Tom reports will be with you very soon, because I am a very angry cat at the moment.